New at 5:30, the mental health crisis still plagues the United States and is getting worse in the Commonwealth, especially for children.
Mental Health America ranked Virginia 48th in youth mental health care access. WHSV's Mike Staley spoke with lawmakers and a local branch of MHA to hear what changes are being made to protect youth across the Commonwealth.
He joins us live in the studio with those details. Mike.
Right. According to statistics from Mental Health America, 60% of youth who have experienced a major depressive episode received no care. Also, across Virginia, there has been a significant increase in emergency department visits relating to suicide attempts or self-harm. Though bills have been passed to help fund mental health services, the issue is continuing to grow in the Commonwealth.
None of those are numbers to be proud of, and they raise significant concerns with legislators, the administration, and I think it's important to note legislators on both sides of the aisle.
According to the Mental Health America Youth Data Statistics, Virginia was ranked 23rd in the U.S. in 2022 in terms of access to mental health care for children. But that drastically changed just a year later, the Commonwealth now sitting at 48th in the country. The new ranking is causing massive concerns for lawmakers on all levels.
We're working really hard to provide resources and we clearly need to do more. And I do want to understand why Virginia changed position so dramatically in 1 year.
Mental health concerns are an invisible issue. Youth across the Commonwealth are silently struggling, but organizations like Mental Health America are working to bring these issues to light.
We're starting to understand that, by the age of 14, there's a lot of youth who have already experienced many symptoms of mental health. And unfortunately, at this point, it's typically an 11-year gap between symptom and treatment.
Bruce Blair with MHA of Augusta says there isn't just one solution for mental health, but the first step is work in the schools.
So what are some of the leading things that really, cause Virginia just to knock a step down the ladder? And then how are those things being addressed in these new bills and new policies coming up in, either U.S. Congress or the Virginia State Congress and stuff like that?
A lot of it is based on school-based supports and ensuring that we have enough workers in the school systems, that the school systems have enough support, that it's not, one counselor on 700 kids, because that's not good for anybody.
Right Help Right Now is an initiative created by Virginia Governor Glenn Youngkin, increasing access to mental health resources for Virginians of all ages. In its focus for children, telehealth services are a key. However, Blair says a voice is missing from the discussions.
It's really getting the youth at the table and having youth leadership help us form some of these policies, help us form some of the things that are done within the school systems. Because youth, I believe at this point, are ready to talk. Youth are pretty open about mental health. They're pretty open about their concerns, I think more so than ever.
The Bipartisan Safe Communities Act is working to provide millions of dollars to invest in children and family mental health services, including school-based programs. U.S. Senator Kaine has also introduced a bill to help create community schools across the country, giving public schools the funding they would need to help address mental health concerns in the hallways. Working hard for you, Mike Staley, WHSV.